All right, we're here today with TJ, and TJ's about to start his procedure with Dr. Davis. So TJ, give us a little bit of background. You came in today for knee pain.
Knee pain.
And how long have you had that?
Probably like 2 or 3 years, 4 years now.
Okay.
And back pain, which I've had for 35 years.
Okay.
The other ones we won't talk about.
So what is a typical day like for you?
Getting up and make sure that I'm stable. I fell down one time because I got up too quick and then I just fell over and bruised some ribs. So
Yeah, that's not good.
I get very carefully get up
Right.
and walk down, take a shower, and then walk down the damn stairs.
Oh, and you've got stairs, so I'm sure that does that's not good.
Hurts me.
That is not good. So you and I had discussed earlier about your discomfort that you're feeling right now. What would you say that number is?
6 at least.
A 6? Okay. All right. So would you be happy if we could get that reduced, say, to a 2 or a 3?
I'd be thrilled.
All right.
Thrilled.
That's going to be our goal for today. Have you seen any other doctors? Have they told you anything about those knees?
Yeah. I got an arthritis doctor up north, and he says, it's time, go get operated.
Okay. So you've got arthritis in there and...
Yeah.
Okay. So they told you a knee replacement?
Yeah.
We're not doing it, right? We're not doing it.
We're going to see.
All right. I'm going to have you do a couple different things for me. And each time I have you do something, I'm going to ask you to tell me where it was hurting when you did that. Okay? So just stand up for me. All right. And where was that hurting, TJ?
The back.
Low back? What about the knees? Did it bother the knees too?
The left knee got mad at me.
Yeah, I heard a pop.
Click. Yeah.
Yeah, a click. Yeah, I heard that. All the way over here. All right, so I'm going to have you just put your feet shoulder length apart. Arms straight out in front of you. Keeping your heels on the ground, I'm going to have you squat down for me as low as you can go. Okay. And slowly come back up. I could see on your face. Where was the hurting at, TJ?
The back and the knees again.
Okay. We're at in the knees, like in the behind the knees,
Behind.
in the back of the knees there? Okay. All right. Now, the next challenge is going to be, I'm going to have you go up and down the stairs. And show us the pretty way how you do it.
Betcha. That would be that
The ramp.
Voila.
Now we get to go back up. He's like, darn it.
We can't use the ramp.
Nope, no ramp. All right, so TJ, which was worse, going up the stairs or coming down?
I always hate going down.
Down the stairs is more difficult?
I think so, yeah. And then you feel like you could fall, you know?
Right, you don't have the stability or the strength.
No.
So we need to get those muscles strong too.
Yeah.
Okay.
That's what going down the stairs is just.
Did you pay attention as to where it was hurting when you were going down the stairs? Was it still in the back of that knee?
In the back.
And that low back too?
Yeah.
Okay. All right, so out of all of those exercises, was it going down the stairs the worst or that squat?
That squat was, I was shaking.
I could see that squat on your face. I'm like, oh my goodness. All right, TJ, you ready to get started? Let's starting with walking. Let's get started with Dr. Davis. We're going to do his treatment and his therapy.
Okay.
All right, you ready?
Yeah.
Come on, you need to have some more enthusiasm.
It depends what you want me to do.
We'll go over all of that. All right, here we go.
So what you're going to do here, I'm just going to move you a little bit and leave this one on. I'm going to bring you up to this point here, rotating here. And then you're gonna take a deep breath and go down. And ideally, TJ, I would want you to do that at the end.
Sideways.
I'm gonna start you in like this. You're gonna try to do this.
And your hand are gonna be on it so I can't.
Well, I'll let you move on this one.
Okay.
But I have to be on this muscle belly the whole time. So
Yeah.
take a deep breath and go down and out. Yep, good, perfect. Down, turn it out, you got it. All the way.
He did that all on his own.
Okay, good. I'm gonna bring you up so it needs to be nice and limp. Good. You can tell me to stop if it's too painful. Okay, take a deep breath and go down and out. 1, 2, 3. Good. Okay, take a deep breath and go down and out. 1, 2. Turn it out. Good. Okay. You don't have to go super strong with this either. Okay. Take a nice deep breath and go down and out. 1 and 2. No, you don't have to go super strong. You can lighten up on the strength. You can go down slower. Okay,
Killing him.
Relax here. Take a nice deep breath. Press. 1, 2, 3, 4, 5, 6, 7, and release it. Let's do 2 more good ones. Deep breath and press. 1, 2, 3, 4, 5, 6, 7. Release. Last one. Knee locked. Take a deep breath and press. 1, 2, 3, 4, 5, 6, 7. Release. Release. Good. And just hold it there.
Don't worry, I got you back.
And you know, if I could push them off, I would. There's no way in hell. Not because I don't like them.
Just to prove a point, right?
Yeah. Okay.
All right, we're back with TJ, and TJ's finished his procedure with Dr. Davis. So, TJ, can you stand up for me? Oh, look at that.
I know it.
How was that?
Much better.
Because before it was your back that was really bothering you. Yeah, all right. So take one step forward, feet shoulder length apart,
Oh.
arms out in front, your favorite. I know. How low can you go? Holy cow!
Huh?
Wow!
Yeah.
Wow! Holy cow!
I'm not shaking.
You're not shaking, and you didn't have that fear, that pain on your face. All right, we're gonna go up and down the stairs, okay? Oh, look at that, 1 foot per step.
That's
You're
that's what it's supposed to be.
Yeah, it's the way it's supposed to be. Now we're gonna go back up. I think you're showing off now. Oh gosh, look how much easier that is for you.
Yeah. Absolutely.
Hey, TJ, what changes have you noticed?
My back doesn't hurt so bad. The legs, I think I didn't feel them.
Right.
You know.
So you had a discomfort of 6 in those knees.
Yeah.
What do you think they are now? Nothing.
3. 2.
Good. Yes. Yes.
Down.
Yes. And the back is feeling better. Knees are feeling better.
And
You
it's time
happy?
to go home.
Yes. And you're gonna have an awesome night. You're gonna sleep like a baby tonight. You're gonna feel like you just ran a marathon.
Oh.
Are you happy with today's visit?
So far, yes.
All right.
Thank
Yes.
you.